Hello and welcome. You're watching the Health Talk session by Yashoda Hospitals. Inflammatory bowel disease or IBD is believed to be a Western disease, but now there has been a significant rise of IBD cases in India, which was almost unheard of 30 years ago. IBD is a group of chronic condition that causes significant inflammation and sometimes damage to the intestinal tract. So what is IBD and what are the symptoms and what are the newer treatment modalities to treat this condition? So let's know more about IBD in our today's episode. I'm Dr. Lakshmi, and joining us today, we have with us Dr. K. Somasekhar Rao, gastroenterologist consultant and hepatologist from Yashoda Hospitals, High Tech City. Welcome to the program, Doctor.
Hi.
So inflammatory bowel disease or IBD. Can you break this terminology for us and explain what this exactly means?
See, basically IBD, as you said, inflammatory bowel disease. The name itself says there is inflammation inside your intestine. It can, the inflammation can be from the oral cavity till the anal canal, anywhere in your intestines. And it is again divided into two types called ulcerative colitis, which is most common. And ulcerative colitis, the name itself says, it is the inflammation of the large intestine or the colon. But the other one is called Crohn's disease, where there can be inflammation or ulcers anywhere from your oral cavity till the anal canal. So this is broadly about IBD.
So IBD was something unheard of, especially in India about 3 decades ago. But now there is a significant number of cases being reported. So what do you think the cause for this could be, doctor?
As you said, 2-3 decades ago, we were seeing very, very few cases of IBD, inflammatory bowel disease in India. So now we have seen a rise, and the rise is very high that at this point of time, India is the second largest IBD patients are in India after the US. So the most important reason now what we found out is we had a genetic predisposition for this disease for long, but because of the environmental factors, now this disease is being surfaced and we are seeing lot of patients here. There is a change in dietary habit. There is a change in climatic environmental factors with lot of pollution and westernization of our diet. All these things superimposed on the background of genetic background. We are seeing lot of cases being surfaced or presenting to us at this point of time. And now we are seeing many cases of inflammatory bowel disease in India.
So what are the symptoms that a patient usually presents for IBD, doctor? Because I'm sure most of the time the patients could be suffering with vague symptoms for a pretty long time and seeking a medical attention only lately.
So we will divide the disease and talk here. When we are talking about ulcerative colitis, the most important symptom would be increased frequency of stool, and there can be bloody stool. So age range would be somewhere around, most of the time, most common age would be somewhere between 20 years and 40 years. If someone in this age group, if they are presenting or complaining of having diarrhea, persistent diarrhea, it can be continuous over a 3 or 4 weeks time, or it can be intermittent and recurrent diarrhea. And if it is associated with blood, definitely we have to suspect ulcerative colitis. And immediately medical attention and a gastroenterologist consultation should be done. And a colonoscopy with a biopsy will clinch the diagnosis. And once we have a diagnosis, we will be able to treat the patient properly. Crohn's disease again is actually, as you said, it's very, very tricky. It can just present with vague abdominal pain for a prolonged period of time. And the diagnosis may not be done maybe 4 or 5 years even after the first symptoms have appeared. This is a problem with Crohn's disease. Then most common symptoms would be abdominal pain associated with vomiting or diarrhea. Pain can be in the periumbilical region or in the lower abdomen. Very rarely we see Crohn's colitis. That means the small intestine is spared, but like in ulcerative colitis, we may see ulcers in the large intestine, and these people can present with bleeding per rectum. And one more presentation of Crohn's disease is they may just present with multiple perianal fistulas or abscesses. Simple blood test, a stool test, and a colonoscopy will give us the diagnosis. Sometimes we may require CT of the abdomen with enteroclysis or enterography to make a diagnosis.
So, discussing about the treatment modalities, doctor, what are the latest or newer treatment modalities available in the market to treat IBD?
See, ulcerative colitis, most of the time we may require simple medications, and just tablets can help. Mesalamine preparations and very, very rarely people who are dependent on steroids, we may have to continue them on steroid sparing medications which are safe for long term, like azathioprine and all. Very, very rarely we would require an injections called biological injections in patients with ulcerative colitis. We use these biological injections mostly in acute severe ulcerative colitis only. But Crohn's disease, the treatment has completely changed. Previously there used to be oral preparations, but no oral preparations are as effective as biological injections at this point of time. There are newer modalities of treatment available which are being tried still, like fecal microbiota transplantation in severe Crohn's disease. It to be approved by FDA, but these are in pipeline at this point of time. But with the available biologicals and immunosuppressants, the treatment response and achieving remission is actually more than 80 to 85% at this point of time in our country.
So, with quite a number of patients being diagnosed with IBD, and of course with newer treatment modalities available in the market, do you think that the quality of life will be affected down the line, doctor?
Most importantly, early diagnosis can definitely avoid multiple complications and in turn improve the quality of life in patients with IBD. So when someone is diagnosed very late, they may present to us with severe malabsorption. They may present to us with stricturizing Crohn's disease, where there can be obstructions and they may require multiple surgeries. This is when the quality of life worsens in patients with IBD. But with this high index of suspicion, if we can make a diagnosis as early as possible and get these patients to remission. Remission is, in other terms, control of the disease. If we can get these patients to remission, their quality of life would be definitely good, and this disease will not affect their quality of life.
So you've mentioned that early diagnosis is the key to treat IBD, and despite the growing number of IBD cases in India, the awareness about this condition is still scant. So how do you think we can address this issue, doctor?
Previously, most of the patients, if they had diarrhea once or twice, even now if I say if someone presents with diarrhea or pain abdomen, they generally tend to consult a local physician. But if these symptoms are recurring, and if someone has multiple episodes of diarrhea or recurrent pain abdomen which is requiring medical attention frequently, first thing they should do is to visit a gastroenterologist. Most of the time, with a high level of suspicion, we will be able to make a quick investigation and diagnosis in all these patients with ulcerative colitis. Most of these people are in the age group of 20 to 40. We can see patients with ulcerative colitis or Crohn's disease even out of this range, but most commonly these are the age group who presents with IBD. So I would suggest most of them should get their routine checkup when they are having these problems regularly, frequently, with a gastroenterologist.
So can you discuss the role of diet and lifestyle modifications that a patient can undertake, especially when dealing with IBD, doctor?
So as we discussed initially, the reason for increase in the number of cases in India is westernization of our diet. Lot of changes in the environmental factors and dietary factors can reverse and help us achieve remission with minimal medications actually. So our native diet, what we have been following for hundreds and thousands of years, which includes good amount of fruits and vegetables, and avoiding all this cheese, excessive oily and fatty foods will definitely help in attaining remission very soon in all these patients. And stress always increases, and stress is one of the reasons for flare of this inflammatory bowel disease. So decreasing the level of stress, that is again with good amount of exercise and all those things, decrease the level of stress, it will decrease the symptoms. The next most important thing is infections. In India, most important reason for any flare in patients who are in well-controlled inflammatory bowel disease is infection. Eating outside or drinking water from outside is a simple source of infection in India. So all these patients who are being treated for inflammatory bowel disease should avoid any food outside, which is a potential source for any bad infections.
So before ending this episode, Doctor, is there any message that you would like to give to our audience out there as far as inflammatory bowel disease is concerned?
So, as I said, inflammatory bowel disease is a lifestyle disease. Inflammatory bowel disease can be prevented by modifying your diet at an early stage, good amount of fresh fruits, fresh vegetables, avoiding outside food, and avoiding excessive cheese, excessive fat in your diet. You may be able to prevent from this disease from happening to you. And in patients who have already diagnosed to have ulcerative colitis or Crohn's disease, if they can stick to this lifestyle again, they will be able to achieve remission very soon with minimal medications. And early diagnosis definitely helps in reversing and maintaining the remission. High index of suspicion from the physician side and from the patient definitely helps in making an early diagnosis.
So thank you, Doctor. It was wonderful having you here on our episode today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic inflammatory bowel disease, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.